it's recording. And we welcome you here this morning to join us. And Anne, I'm going to hand it on over to you.
Good morning. Thanks, Judy. And again, welcome to our Healthcare for All Minnesota quarterly meeting. Thanks to Judy, our administrative coordinator, for hosting, and then Jen Crawford, Executive Director of Physicians for National Health Program Minnesota, is standing by to assist if we need her. I am Ann Jones, retired RN and Vice Chair of Healthcare for All Minnesota. And thank you for choosing to spend some of your morning with us to talk about the issue of health justice for all and get our updates that we've prepared for you today. Our presenters today are Judy Barton, Mark Brocky, our chair, Don Pilkinen, our secretary treasurer and legislative committee liaison, Dave Garibaldi, a board member, Carolyn Hankey, our social media specialist, and me. And our agenda will include a welcome and remarks from our board chair, Mark, a financial report from our treasurer, a report on some of the work our legislative committee has been doing in anticipation of election 2022. Then we're going to give you a report on outreach events that we've accomplished this spring, summer, and fall so far. Some social media tips from Carolyn Hankey in an effort to get people more engaged with our social media sites. I'm going to talk a little bit about why we need to be politically active and give some announcements from our Education and Outreach Committee, and then we'll wrap it up. So let me invite Dr. Brocky to start us out this morning.
Good morning. It's nice to have you all here with us on this Saturday morning to help us work on the problem of improving healthcare in Minnesota and pursuing our goal of getting the Minnesota Health Plan passed. I ended up with an addition to what I wanted to talk about this morning yesterday when I got an email from a contact of mine, and he shared with me a press release from MNsure. It turns out that MNsure, the Minnesota Health Insurance Marketplace, just announced that they're going to be giving $4.2 million in grants to 22 different organizations to support the MNsure navigators. In other words, the health insurance system we have is so complicated that the state is having to spend a significant amount of money, in this case, an additional $4.2 million to help people navigate a system which is unduly complicated. Just another evidence of the dysfunction that we have in our health insurance system. Well, getting on to the remarks I was going to make, 2022 has been a productive year, and we're only 3/4 of the way through the year so far. I just want to mention a few of the things that we've been involved in this year that are either new to this year or were new near the tail end of last year. So we have been producing a monthly newsletter. The Education and Outreach Committee is producing monthly educational meetings using Zoom. We had a productive and fun fundraising event in May. We are actively collaborating with PNHP Minnesota on many activities. We have participated in Minneapolis Pride Festival, the League of Minnesota Cities annual convention, Farm Fest, and the Minnesota State Fair. I should not forget the COACT Farm Picnic in Pierce, Minnesota, which is significant enough that it is attended every year by the Minnesota Commissioner of Agriculture. We have further activities coming up this year, including the Minnesota Farmers Union Annual Convention. And I would be remiss if I did not mention the excellent work that Carolyn Hankey has been doing this year to manage our social media presence, which previously was insignificant and now is very nicely managed. And if you haven't been on our social media, particularly Facebook and Instagram, we invite you to spend some time there and work on sharing our messages with your friends and contacts. You know, although we have been busy and reaching quite a few new people this year, it is important to recognize that this is the beginning of our work and that we need to extend our influence further. So one priority I would like to suggest to you is that since it is election season, we hope that you will all be devoting your energy to supporting candidates who truly want to fix our healthcare mess. We hope that you make it clear to your legislators that anything less than universal, affordable, high-quality healthcare is unacceptable. Don Pilkinen is going to be following me, and I just want to say, without stealing any of the comments he's going to make, that he's going to talk about healthcare for all Minnesotans' need for your financial support. And indeed, without you and others providing us with support, we cannot do the work that we're doing, and we will not be able to expand our work. So we very much hope that you will talk to your friends and contacts and get them involved in supporting us as well. So those are my initial remarks, and I will pass the mic along to Don Pilkinen.
Yeah, thanks, Mark, and good morning, everybody. And Mark, I've never been too shy about begging for money for worthy causes. I've never been too shy or too proud of asking for what's necessary to proceed with our work towards our goal for the Minnesota Health Plan, Healthcare for All. The projected activities for the summer, as reported at the June quarterly meeting, came to fruition with tablings at Pride Fest and the League of Minnesota Cities Conference in June. They were both in June, Farm Fest in August, and most recently, 12 days at the State Fair. The addition of Farm Fest, the Minnesota Cities Conference, and the State Fair gave us the busiest summer with the most volunteers to date, which resulted in reaching and educating more people on the Minnesota Health Plan than previous summers. Unsurprisingly, these activities came with higher price tags of 4 booth rental fees, liability insurance, 2 new banners, plus new signs, brochures, buttons, which added up to the biggest period of expenses so far. But the payoff of expanded education and outreach, especially in Western Minnesota at Farm Fest, and more signups were worth the higher bill, for which COACT helped with the costs of the Minnesota Cities Conference, and PNHP Minnesota helped with the State Fair costs. Meanwhile, this continues to require ongoing work hours for our social media specialist, Carolyn Hankey, who you previously mentioned and lauded, who is increasing traffic on Facebook and other platforms, which is engaging more young people to become activists. Also, there's fees for every action in Zoom for more meetings and webinars. And of course, Administrator Judy Barton's excellent work in coordinating these activities with several committees, plus helping with planning and coordinating fundraising activities. For those of you who want to pitch in going forward, you can easily do so by making online tax-deductible donations to our 501c3 HCAM Education Foundation. Just click the donation button on the upper right corner of our website's homepage that connects you to the contribution page. If you prefer donating by check, you can get a tax deduction by writing your check to the HCAM Education Foundation and sending it to HCAM. Especially helpful would be your consideration of a monthly sustaining donation, which would really help in budgeting money we can count on and would boost the credibility of public support to show to prospective foundations in our grant applications. For the work that lies ahead in 2023, thank you to those of you who have chosen to make a donation of any size. Everything helps.
Thank you so much, Don. And next on our agenda is Don gets to stay on the screen and talk about the work of the Legislative Committee and election
And-
2022.
And I'm just going to interrupt for one moment. Jen put in the chat the link for donations. There's actually a button on the donation page that you can check, and you can make your donation monthly that way, or you can make it quarterly or even twice a year so that we can budget. Thanks.
Okay, go ahead, Don, with our next agenda item.
Thanks, Ann and Judy. With the passing of Labor Day, the time is now upon us to set ourselves to do the political task that's required for advancing the Minnesota Health Plan towards passage and enactment. Now that we have the Minnesota Health Plan bill to enact single payer and the election campaigns are well underway, it now requires electoral work by everyone who's willing to get enough supportive candidates elected to hold the House majority and to gain a Senate majority, along with adding more legislators to strengthen the Minnesota Health Plan Legislative Caucus. Majorities in both houses, the House of Representatives and the Senate, and leadership of a strong health plan caucus are needed to get committee hearings on the bill in the 2023 session, which were blocked by a divided legislature last session. Therefore, to help us with the work that lies ahead, an HCAM legislative subcommittee of Mark Peterson, who's our legislative committee chair, Jim Hart, Mark Brocky, and myself have identified, by using electoral criteria, Senate and House candidates who would be the most wild for volunteers to do the door knocking, phone calling, tabling, and flyering to help get them elected. By worthwhile, we mean those candidates who will or are most likely to work for the bill in the legislature, but who have only a small edge in competitive legislative districts where volunteers are the most needed. And that's not to say that volunteers shouldn't work for supportive and qualified candidates in safe districts if that's their choice. The subcommittee's task was only to identify and list those candidates who need the most help, which will be available to those of you who want to give it. The Senate candidates evaluation table on the screen And if you could please get the table up on the screen, thank you. This shows you the format we used to be as objective as we could in determining candidates for you and others to consider working for. By being out of the metro area, these candidates are in more competitive districts where the resident constituents are needed to help, of course, along with those of us metro folks who are willing to do phone calling from home or to travel there to do door knocking and flyering and tablings and such. The first two columns in the table identify the candidates and their locations, and the other columns show the electoral criteria of partisan odds in the districts, the candidates' positions on the Minnesota Health Plan or healthcare finance reform, and their progressiveness on issues, and their electability, including public service and experience, endorsements, and campaign strength. The last column will provide the links to the candidates' websites where we can go to volunteer for phone calling, door knocking, and other campaign work. It will also show our key HCAM contacts in those districts for you to connect with. In other words, we have COAC members who have become knowledgeable of the qualifications and the need for help in these districts. Excuse me. When the subcommittee finalizes the candidates list this coming week, it will be sent to HCAM's contact list of supporters in those competitive legislative districts and to the rest of us who will want to help there. Thank you to those who volunteered to work in the electoral process, which is the essence of our democracy.
Thanks so much, Don. This is incredibly helpful. And will your committee be working on a document similar to this for the House side?
Yes, we actually have that pretty well finalized as well. But I just wanted to have you show to attendees today what the layout is that will be sent out to volunteers this coming week.
Okay, thank you so much. We will move forward to our, we thought it would be interesting for people on this meeting today to hear some of the work that volunteers have done with some of the bigger events that we did this year once we resumed in-person outreach. But I will also mention that we're highlighting 3, but there are other events went on in Duluth, Mankato, Northfield, and Woodbury to include a few. And if we haven't included the work that some of you on this call have done, my apologies, and feel free to get us some information on that. We might be able to put something in our newsletter. Events included Earth Day, May Day in South Minneapolis, conventions, Juneteenth celebrations. This was our 3rd year at the Twin Cities Pride Festival, where we partnered with PNHP Minnesota again. This event is over a weekend in June, and we schedule 5 to 7 volunteers per shift, and they are usually very busy with people stopping by to talk to us, get information. Sorry, missed my protocol here on who should be on the screen. We probably talked to about between 500 and 600 people in 2 days. Again, most of those attendees are with us on fixing how we pay for healthcare, but it is a challenge still to get people involved and actually, do something going forward other than just, being a name on a mailing list. Members of the LGBTQIA community do have special healthcare needs and many other challenges. Also, I'll mention that HCAM activists are participating in Pride events in Duluth, Superior, and Mankato this weekend. So let me call up Dave Garibaldi, who's going to talk about the League of Minnesota Cities convention, which we did for the first time this year. Dave, do you want to turn on your screen, and the rest of us will turn our videos off?
Yes, I am here.
Okay.
What's up? One moment. There we go. So City Council resolutions of support can potentially be impactful to our movement by putting additional pressure on legislators to pass single-payer legislation, as well as informing the residents of cities of the advantages of a universal single-payer plan. With that said, we had 4 City Council resolutions of support already passed and several more in progress by HCAM volunteers around the state. It seemed logical for HCAM to table at the League of Minnesota Cities annual conference in Duluth on June 22nd of this year. We made the arrangements and got into the conference as an exhibitor on their first day for a 3-hour session. A little bit of background with the league is that there are 837 member cities in the state, and this is an association of elected and appointed city officials which promote excellence in local government through effective advocacy, expert analysis, and trusted guidance for all Minnesota cities. The league values the longstanding city-state partnership in Minnesota and strives to maintain robust, constructive communication between cities and state policymakers on issues affecting local communities. So that's where we come in. We wanted to make sure that this became an issue that they prioritized in their contact with legislature. Following City Council endorsements of the Minnesota Health Plan to replace costly commercial employee health plans, sponsors of the resolution explained the single payer solution to other concerned City Council members and officials. Duluth and Osseo resolution sponsors, Joel Cypress of Duluth and Juliana Holstrom of Osseo, briefed colleagues from cities elsewhere in the state at Healthcare for All Minnesota's booth. Although all city budgets are struggling with rising costs of for-profit plans, Joel observed that the most supportive conversations were with administrative staff and small greater Minnesota cities which are unable to afford decent healthcare coverage for their employees. This bottom line's the problem, so all council members know that their cities aren't standing alone in the employee health insurance crisis. The Duluth, Osseo, St. Paul, and St. Louis Park endorsements and relations with the League of Minnesota Cities built momentum to get local governments statewide to pass the resolution because legislators need to see local support for the Minnesota Health Plan. Knowing that Main Street businesses like city governments lose money and time in dealing with commercial health plans, the city resolutions cite Minnesota businesses paying premium costs above the national average, and that their revenue was further hurt by the insurance company's lack of forbearance on costly premium payments during the COVID pandemic. Therefore, the resolutions state that the Minnesota Health Plan will relieve public and private employers of health insurance. This is why the business associations of Main Street Alliance and Metro Independent Business Alliance are partners in Healthcare for All Minnesota, along with the Minnesota Farmers Union, which ranked health insurance as farmers' #1 problem. Stopping at HCAM's booth to learn about the Minnesota Health Plan resolution were council members, treasurers, administrators, and clerks of cities ranging from Lancaster in the northwest, near the Canadian border, down to Chatfield in the far southeast, with cities such as Detroit Lakes, Grand Rapids, Mora, Vadnais Heights, Minnetonka, and Hastings in between. In addition to following up with contacts made at the conference, we are hopeful for other possible collaborations with the League of Minnesota Cities. Osseo City Council member Juliana Holstrom, as a member of the League's Human Resources and Data Practices Committee, has submitted a policy proposal of support for the Minnesota Health Plan, which hopefully will be added to the League of Minnesota Cities legislative priorities for the 2023 legislative session. She will also push for the LMC to allow HCAM to do educational breakout presentations at the next annual conference next summer, and other League of Minnesota City events. And with that, that's all I had. I do want to note that, as you can see by the photo, which was on the screen, that we did approach this from a fiscal responsibility standpoint to possibly draw in more conservative members of councils and mayors to really look at this as something that is fiscally conservative and fiscally responsible with their taxpayer dollars. So hence the big bite shark on the banner behind us. So that's all I have. Thank you.
Thanks a lot, Dave. So Mark is going to give us a report on our first ever adventure to Redwood Falls for Farm Fest.
Well, thank you, Ann. I think that's a pretty good description of it. It was a bit of an adventure. Many of you are familiar with Farm Fest, but for those who aren't, Farm Fest is the largest agricultural trade show in Minnesota. It's large enough that there are over 500 exhibitors, and it gets over 30,000 visitors over the 3 days that it takes place. We had a booth, 10 by 12 booth in the exhibitor tents. That's a covered area for the people who don't have to have a large area to display farm machinery. I want to thank all of the Healthcare for All Minnesota and PNHP people who came to the Redwood Falls area to Farm Fest to help us staff the booth. It was fun to meet some of those folks who I had previously only seen on Zoom meetings, and they made the event a success for us. So of the 500 plus exhibitors, there were approximately 150 exhibitors in the covered tents where we were located. We made a point of going around and talking to each one of the other exhibitors who were in the area. And I want to thank Don Pilkin and John Crossan, particularly, who were instrumental in helping to talk to all of the other exhibitors. We got a lot of positive feedback from the other exhibitors, and we think that the the contacts we make with the exhibitors are just as important as contacts we make with the attendees. I want to talk a little bit about some of the contacts we had with attendees. Most of the attendees see at least part of the problem with Minnesota healthcare. They definitely want to see those problems resolved, but it would also be true that the majority of them are not familiar with the Minnesota Health Plan, and the majority of them have not been studying the issue enough to understand why the Minnesota Health Plan is the ideal way to go about fixing the healthcare mess that we have. I'm going to try to show you something here on the screen. You see this nicely embossed business card. This is a card that comes from Congressman Angie Craig's office, and a gentleman whose name is Les Anderson stopped by to chat with us the last day that we were at Farm Fest, and he had a shirt on it that said Angie Craig staff, and turns out that his card says agriculture community liaison. So he works with Angie Craig to communicate the needs of the farming community. And Ann was having an animated conversation with him for a while, and near the end of the conversation, somehow the subject of political parties came up, and this gentleman said that he normally considered himself to be a Republican, and you should have seen the surprised look on Ann's face when the person she'd been chatting with about healthcare finance reform revealed himself to be a Republican. But I think that he, fortunately, is in the group of Republicans who are rational and not opposed to making progress in the world. Let's see. Let me just mention a few of the other more standard contacts we had. We had a soft offer from one of the radio outlets that was there for us to be interviewed at the 2023 Farm Fest. We also stopped by the booth of a newsletter for the rural communities in Minnesota. This publication is called The Land, and The Land has a circulation of approximately 20,000. They have two editions, one for northern Minnesota and one for southern Minnesota, and they publish those editions on alternate weeks. Well, bottom line is that The Land has offered Healthcare for All Minnesota the opportunity to write a monthly column for their rural newsletter. So we are really looking forward to working on that project. One of the exhibitors I met was sufficiently enthusiastic about the idea of healthcare finance reform that he took a pile of my business cards to distribute to his contacts. I also had the good luck to be on an interception course with Governor Walz on the day that he was at Farm Fest, and I took the opportunity to intercept him and introduce myself, tell him that I was involved with Healthcare for All Minnesota, and his comment was, "Keep up the advocacy." And I'm going to close out my thoughts on Farm Fest with a general thought for all of us on this meeting today, and that is to echo the governor and say that that is our challenge, is to keep up the advocacy. Together, we can grow our movement and pass the Minnesota Health Plan. Ann?
Thanks so much, Mark. I was there with Mark for all 3 days. And just quickly, since we do have a couple minutes extra, 3 stories really stick out for me from the experience. Well, 4 impressions. There was a discouraging, I'd say maybe 10 or 20% of people older who are on Medicare who think they're fine and aren't exactly interested in helping us move this along, that's worrisome and discouraging. But they were balanced out by stories like the farmer who stopped by and was very concerned about his son. He's trying to pass his farm on to his 2 sons. It's a hog farming operation. He said one does not have insurance, and I am very worried about him. We actually gave him the number for MNsure, but said we're not in the business of promoting commercial health insurance. We want to fix this. But want to be sympathetic to a problem right now. Another one was a young physician who is the only physician in a really small hospital in greater Minnesota, and he said single payer right now, absolutely, we need this. And I guess the third one was a very outgoing guy with lots of things he kind of does on the side, and he came up to us and said 90% of people's problems would be solved if you would just fix this mess. And of course we invited everybody to join us in the fight. So anyway, an experience. Yes, thanks a lot, Mark. And Judy Barton and I are going to talk a little bit about our biggest event, which was 12 days at the state fair. We decided to do this. This was actually a suggestion by John Crossan at PHP Minnesota last year. And I said, we'll never be able to pull that off. And then we kind of reevaluated. It was a little bit too late in the year. We reevaluated and we talked about it again this year. When we looked into the cost, it was actually reasonable enough that we thought we could do it, and we really needed to do this to get the kind of exposure to people across the state of Minnesota that in the most efficient way possible, we would have no chance of doing any other way with our usual outreach efforts. So staffing a booth at the Minnesota State Fair is the biggest thing we've attempted as an organization, at least since I've been on the board. We partnered with Physicians for a National Health Program Minnesota and pulled off what I think was a really successful outreach event. We applied in June, and I guess I learned that you don't always get in the first year, but we were selected to have a booth in the education building. We formed an event subcommittee of Jen Crawford, Executive Director of PNHP Minnesota, Judy Barton, Carolyn Henke, and me to plan all 3 of our bigger events, Twin Cities Pride, Farm Fest with Mark Rocky, and the State Fair. The biggest challenge with the fair, of course, is staffing a booth 12 hours a day for all 12 days of the fair. And let me stop right here and thank all of our wonderful volunteers who showed up with good energy and commitment to this cause. We talked to hundreds of people from all over the state of Minnesota, again, who we would have little chance of meeting using our usual outreach events. And we couldn't have done this without you, our volunteers. We chose to pay a little extra for a corner booth, 10 by 10 space, but we got some exposure to the whole, let's say the area of the education building that we were in. And my experience was that we got great exposure at this location, which was across from and kitty corner from the state legislature booth. Our layout was open rather than standing behind tables because we were trying to encourage conversations. We had 2 activities, a board for people to write on in the back on the right there, what having healthcare would mean on stickies. And Carolyn's been really good about taking some of these comments and turning them into social media posts, which I hope you're getting a chance to see. And then the health insurance Wheel of Misfortune, which has been Dave Garibaldi's project. I think we almost wore that thing out at the fair this year. Lots of children stopped by because there are these wheels all over the education building. And these kids want to spin every one. Unfortunately, on ours, there's not much good news. there's no real prizes. We're gonna have to maybe fix our tone a little bit for next year and figure out what people can win if they hit the right part of the wheel. But that meant the parents had to stop, and they often took at least a brochure. Our big banner in the back, which Mark created, also attracted people who asked us, well, so what's the fix? And I spent quite a bit of time in our booth. So I'll share my experience in interacting with people who stopped. Other people might have had some different experiences. And I'll just caveat this by saying that we realized that people who chose to stop were at least curious about or open to why we were there, or perhaps they had to stop because their kids stopped them. I don't have any hard data, but I'm just going to give some rough estimates of what the responses were like. And I'm going to say that about 5 to 10 people were outright opposed with the usual objections. I don't want government involved in my healthcare. We're skeptical about the costs and waiting times and other insurance company talking points that they've been hearing for years and years. I'd say maybe another 20 or 30% who feel that they're covered and not very open to change. And those included people on Medicare, some with employer-sponsored insurance, although many agreed that it was still expensive. I gave out a lot of handouts to people who are on Medicare explaining the threats to Medicare. And most people had never heard of what we see as threats on the horizon to Medicare, which, side note, I'll encourage you to go to pnhp.org website and check out their work on protecting Medicare. Another 10 to 20%, I would say, we're open to hearing about what we think the fix is, and then at least open to hearing an explanation and taking materials. And maybe 30 to 40% are clearly with us. Single payer, yes, sign me up. What can I do? And the like. Young people, I noticed, were either not affected yet or very concerned about their futures under the current system. Most people are familiar with the phrase Medicare for all, if I ask the question, but I don't think I talked to anyone who really knew anything about the Minnesota Health Plan itself. So we do have work to do, or the concept of a state-based health plan, and then working toward a national health plan. So going by the number of brochures that we handed out, I'm estimating that we talked to at least 1,400 people over the 12 days, maybe more. Our goal was to have some meaningful conversations, not necessarily push, or put a clipboard under people's names, but try to have some conversations, hear what their concerns are, figure out who's open to this, to the information and this change, this potential change, and then invited them to join us in the fight. I mean, join us in getting this done or moving it along. We used our new digital tools. We used QR codes that people could just put on their phones, and our tablets for building our mailing list. And we also have a new brochure that I wanted to show you. And this was the result of Carolyn Henke did the initial layout, and then Jen, Judy, and I did some edits. I think it turned out very well. It turns into a trifold that gives people kind of an attention getter, who we are, some questions, pique some curiosity, what we believe the fix is, and then some other information inside about why we care about this. We don't just want to talk about cost. We want to talk about how many people are left out under our current system, and as a justice piece on why we need to fix this. Who is this for? Not just the people who don't have insurance, or not just the people who are spending too much, but everybody. And then what can you do over on the right? So I'll mention that we all need to be carrying around, as organizers, if we want this to happen, we need to be carrying around business cards, wearing a button, and having some brochures ready to hand out. And I can send these out. We ordered enough to have a lot of materials to use going forward. I can put this in the mail for anybody who is either planning an event in your local area or is really interested in having something in your hand ready to hand out when you have a good conversation. So with that, I'll turn this over to Judy to talk more about her experiences.
Sure.
our
Thanks.
event.
Thanks, Anne.
Okay.
The special fundraiser for the state fair I wanted to talk about briefly. Thank you to everyone who donated some funds to help us cover the costs for the state fair. Again, it was nearly $5,000 to host the booth at the state fair, and that included purchasing 2 tablets for people to sign up on directly, as well as all of the printed materials, the cost for the booth. We chose not to connect to the internet, and so thanks to Jen Crawford and her husband for setting up a form so we didn't have to pay another $450 to have access to the internet at the state fair. We were trying to keep our costs as low as possible, and they set up a very nice form on the tablets that saved all the data, and so then we can upload it and not have to pay for, instant upload via the internet. Overall, we raised $1,400 through that special fundraiser for the state fair costs. So again, thank you to anyone who donated to it. We greatly appreciate it. I had a lot of fun at the state fair. It was the first time I have ever in my life been to a state fair. And I also got my first bee sting there ever. So a few firsts for me, but I think it was a great event. In general, I found most people were positive. You'd have those few people who were negative, but by and large, most people were positive. Some serious questions about how feasible is this would be asked. So with that, I think I am done. I don't have anything else to add to Anne. Jen, do you have any comments that you wanted to add?
No, just thank you everyone who volunteered, anyone who donated. It was a very big event for everyone, and we were so glad to be able to partner alongside HCAM, and we hope to do it in the future as well. So thank you for volunteering, and if you did, you'll be receiving a survey soon. We really hope that you'll fill that out to help us do our best in years to come. So thank you so much, and thank you everybody at HCAM.
Thanks, Jen.
Thank you. I will add that when people asked us how do we get this done, I shamelessly said, this is where you come in. Are you registered to vote? Do you know who your representatives are and who's running in your district? I found out that most people did not. And I said, this is going to take people power. I mean, I think we have to get really pretty direct about saying, this isn't going to happen because I show up. This is going to happen because all of us show up. So thanks again. Fun working with our events subcommittee team. And I don't think it's going to be fixed by next year. So we'll be looking into these events again for next year. So I'm going to invite Carolyn to talk to us about social media engagement, and some tips for how we can engage with our social media sites more effectively. Carolyn, I'm going to take down my slides and let you take over.
Okay. Hi, everyone. My name is Carolyn. I'm the social media specialist for Healthcare for All Minnesota. And I'm going to share just a social media update for us. Sorry, I meant to put this on the thing, but it got a little messed up. So this is a presentation about where we're at with our social media. As a lot of us know, social media is a great tool in our toolbox for advocacy. It really helps people know what's going on in the world of healthcare for all Minnesota. People can follow us to get updates, to know where they can turn to for volunteering, things like that. So social media is a great tool. Obviously, it's not the only thing. That's why we're doing so many other things, but social media is really good for keeping people updated and also attracting new supporters. So just overall things with social media, our pages continue to grow. We're getting new followers, which again increases our support. You can see some of our followings on Instagram, Facebook, LinkedIn, and Twitter. An important note is on our social media platforms, the primary people that we're reaching are women. And so it's around 65% women and 35% men. And we see we're reaching an older demographic on Facebook and a younger generation on Instagram. This is important to know for the type of content that we're posting, just to make sure it's relevant to these age groups and that we are having them see that we can support them as well, that we care about their issues. So on Instagram, it would be more about people who are turning 26 and losing their health insurance, or dealing with expensive co-pays, co-insurance, or plans. And then on Facebook, it could be the same. People are still worried about those things, but also on Facebook, the generation is more concerned about Medicare and making sure that that is a good program for them still. So then some good content that we've seen throughout this month is, again, highlighting the fair. People were really excited to see that we're out here on the fair. And then some posts, some tweets about how it's really infuriating to see people in the hospital having to continue to telework because they don't want to lose their insurance. And then also some reels. We've been getting into reels, or there are videos on Instagram that are really popular. And then also talking about why is a third party helping or trying to get in the way of your healthcare. So really trying to shift the narrative into thinking that we don't need a third party in our way. It's just getting in our way and adding to the cost of our healthcare system. Some key messaging that really works for Healthcare for All Minnesota are things that are very easy to follow. We're not using any jargon or a lot of political talk, since we are trying to reach everyday people to, like Anne said, join our movement. It's not enough for just us to show up. We have to get everyone involved. So we need to use language that's helpful for everyone. It's relevant to our audience. And it's a blend of the sad truth, as our healthcare system is quite dismal right now, but also looking towards a hopeful future, seeing that it can get better. So we'd like to use a balance of that, because it can be very depressing to just read things about how crappy our healthcare system is right now. So we like to give hope. And then simple words and phrases that are easy to understand. So some upcoming events for our social media is we're working on getting fundraising up on Facebook. So that will be really great. That will help us a lot, and showcasing our events. So all the amazing things we've been doing this summer, we're gonna be posting more about those on social media. And then I'll share a different slide in a little bit, but just make sure that you're liking, following, and sharing the post so we continue to spread this message, especially across Minnesota. So I'm going to share a different, can you all see this? Is this working?
No.
Okay, let
Oh.
me. Let me just share my screen again. Oh, sorry, let me just pull this up and. Okay, so I'm not gonna dive too much into this, but we'll send this out as well in an email about how to use social media. In case you are new to social media and want more information. But social media, like I said, is a great tool, and it really helps when our supporters will like and share and follow us. So this is just some information about how to use Facebook. If you're not already following us, you can search for Healthcare for All Minnesota in the search bar, and then make sure you like our page and interact with the post. So you can like right on the bottom left, you can comment on the post, share your thoughts, and you can also share the post so it shares with your audience. And it's really similar on Instagram. On Instagram, our page is called Healthcare for All Minnesota as well. And then you can also follow us, make sure to follow us on all social media platforms, whatever you're using, and then interact with the posts as well. So like, comment, and share. And again, it's the same on Twitter. I'm going kind of fast on this, but we can send this in an email afterwards. But again, we're Healthcare for All Minnesota on all social media platforms, and you can follow us here and interact with our posts, comment, retweet, and like. So again, we can be sharing that in an email if you're unaware. And if you have any questions, my email is carolynhandke@gmail.com. So yeah.
Thanks, Carolyn. Appreciate all your work. And I would really encourage everyone, I'm saying this to myself also, take 5 or 10 minutes a day and see what's new and see if you can interact with and expand this work. I'm going to ask Carolyn a question. If I don't have very many Instagram followers, I need to build that up. Is that correct? In order to be useful on Instagram? Because if it says share to followers, it's only going to a handful unless I have more followers. Is that right?
Yeah, it'll just go to the
Okay.
people who follow you. It's okay
Okay.
if you don't have many followers. That's not a big deal. It's still good to get the message out to no matter how many people follow you. So that's okay.
And I would invite people, feel free to share good content with Carolyn, or send it to our info@hca-mn.org email address on our website. So thanks a lot. Appreciate that. I'm going to go on to, looks like we're even a little bit ahead of schedule. Go on to our next 2 agenda items. Let me share screen. Information from our Education and Outreach Committee on building our base and some announcements. But I first want to echo everything that Don has said, and Mark, and I guess reinforce that we are in an election cycle. It's a really important election cycle for a lot of reasons. Every campaign, as Don pointed out, needs a lot of help. And just I'll note that not every legislator or candidate are well informed on health policy or proposals to fix how we pay for healthcare in Minnesota. So the more well informed we are, the more we can do to help share information with these legislators and candidates. Healthcare and health policy is not a specialty for everybody. One thing we can do when we help out campaigns, it's been my experience that candidates remember you, and elected officials remember you if you have done some work with them. And it's a great way to build relationships. They will never forget if you knock on doors for their campaign, or make some phone calls. So it's not only a great way to build those relationships, but also an opportunity for us to be an honest broker on information for healthcare payment reform. So I'll just kind of take a moment to reinforce what you're probably hearing in the news, that everything is on the ballot in 2022, from the climate crisis to healthcare to gun violence prevention, voting rights, women's rights, civil rights, education, labor rights, consumer protections, national security, American democracy. Again, every campaign needs people to knock on doors, make phone calls, donate money, help with mailings, even put out lawn signs, do lit drops, and just get involved in the electoral process. Encourage others. So find ways to help on campaigns this cycle, and then encourage people also to be a healthcare voter. We are Healthcare for All Minnesota and PNHP Minnesota are officially nonpartisan, but we have to have a legislature and a Congress who are with us on fixing how we pay for healthcare. And the party in the majority in the state Senate has been a barrier to getting hearings on the bills. The Minnesota Health Plan has been reintroduced several times every 2 years, and you notice that we haven't had committee hearings yet, and there's a pretty good reason for that. So we're going to try to change those majorities. Once we get a legislature friendly to health and human services, we still have to push hard for change. We can get the right majorities, but it doesn't mean that these bills will be on the agenda unless we push for hearings. We do have the advantage a little with this next cycle with the formation of the Minnesota Health Plan Legislative Caucus. So we kind of will have people pushing a little bit harder than perhaps in the past to push for hearings. Even if your candidates or representatives are not officially, have not joined this caucus, that's not essential. It would be very helpful though if they co-sponsor the bill, or at least, formally co-sponsor the bill, or at least be supportive. We're going to need people, when we get hearings, to show up, push for these hearings, provide testifiers, connect with like-minded organizations. And I just say, look at the numbers and organization that it has taken to get the public to pay some attention to gun violence prevention, global warming, and other crises, now women's reproductive rights, and so much more. I often think about the disconnect between the level of need for change in how we pay for healthcare and lack of intensity of public pressure for change. We have the data, we have stories, we have legislation ready to go. We know what we believe would work better for our state and our country. And yet the power of the status quo combined with very well-funded opposition manages to sink reform on this issue every time it gets to the top of the list. So even when polls show that the cost of healthcare is a top issue for a majority of voters, until the COVID-19 pandemic crisis put our healthcare system on the front page, hundreds of people were dying every day, and tens of thousands more went without the healthcare they need or went into debt. They're just not in the streets. So no one sees or hears about it, at least not in the ways that force the action needed to overcome the big money, the ideological barriers, and the fear of change. So this is our work ongoing. We continue to educate the public, continue to organize the numbers we need to push for change. And we're going to have to fill that rotunda, fill those hearing rooms, and be in contact with our representatives to push for change going forward and bring more people into the fight. I can't stress that enough. So our ask is please get involved. Don and the Legislative Committee have given us a roadmap for getting involved in campaigns around the state. Info on the House races will be coming out. We need majorities in both chambers who will hear the bill. And just keep in mind that the majority party in each chamber appoints the committee members and the chairs. The majority party sets the agenda. It's really about creating the political will for change and building people power on our side of we're the outside game, so to speak. So whether you are new to this issue, you've been pushing issues like this for years, if we want to get the Minnesota Health Plan on the agenda, we need people in those seats who will champion from the inside while we do the work to build public support outside. Hope that's helpful as kind of a general approach to the strategy for our work. And then I'll just talk a little bit about what we've got coming up. We are asking you to set up accounts on these social media platforms, if not all of them. If you don't already have them, at least pick one or two. Go in and interact with these sites. Share the content being posted. Don't just click by it. Share and comment. Send ideas for content to Carolyn or to our email address. Please subscribe to our YouTube channel. That seems to be very important. I don't know exactly how it works. Please subscribe, like the programs posted, and you can also share videos that you see that you think are good. Please read and share our monthly newsletter and check the website. Judy's done a lot of updating. We have a number of new articles posted. Dave Garibaldi's been really good about searching out articles and suggesting, and anyone can do that. Submit it to, again, our email site. Also check for legislative updates. And then the Minnesota Health Plan website, which is mnhealthplan.org, is updated and loaded with good information, including an extensive frequently asked questions section. So a couple things we've got coming up. In addition, you'll see events on our calendar under Get Involved. Also, send people to the calendar. Often, if you can't register any other way, you can click on an event on a calendar and register. We've got an educational forum that we are collaborating. Well, I shouldn't say the word. We'll just say our Minnesota Legislative Caucus has set up an educational forum on Saturday, September 24th. It's at a venue that is owned by a candidate running in that area, and will include participation from a couple of Senate candidates, the House candidates, the person who owns the location we're going to use. I think it's the Grey Duck Theater in Rochester. It's going to be at 3 o'clock in the afternoon on September 24th, and details will be on the calendar. We're following a Keith Ellison event, so there's, I guess, a chance that there could be some pretty good attendance. Our part will be to organize and hopefully get contact information and use this as an organizing event and continue to build our base of support for this legislation. And then we will be resuming our monthly educational events on Thursday, October 13th. That's the second Thursday in October, with a program called Managed Care by Rose Roach. She calls it Managed Care EIEIO because of all the complicated and rather useless strategies that have been used to contain costs that aren't working. And then I want you to look for events designed to bring younger people into this movement. Judy, I think Carolyn, Maggie, Emery, who is one of our newer board members, are going to be starting up some events to attract younger people into this movement. So it isn't just my demographic, our demographic who are working on this important issue. And I will end by sending out, we usually send out these slides with all the information you're going to need to know. I always say the more you know. There's lots of great resources on this slide, including the Fix-It videos, which you can share. Those are still good, and you can share those with people if you're having trouble yourself explaining what we're trying to accomplish. If you haven't read Senator Marty's book, I always say please do that. If you haven't visited our website lately, again, please check it out. And the PNHP Minnesota website has information, and the pnhp.org, which is the national organization, has a lot of information, especially on the economics of reform, fixing how we pay for healthcare. And a box will pop up, a big square box that will send you to a Protect Medicare website as well. Want to remind you to check that out. And if you haven't done it, please go to that site. Again, other websites of allied organizations, and including the Labor Campaign for Single Payer. Public Citizen has been a long time supporter. And also we want to encourage you to go to the One Payer States website. They've done a lot of work in building that website and holding events. And they are planning, just had a health justice summit August 22nd that I did manage to sign into, and more are planned on not only more interaction with intergenerational and other groups and organizations we need to bring into this work, including members of the Black, Indigenous, and persons of color groups. Let me just again make a pitch for getting your help to spread the message. I always say this is about bringing more people to the fight. And we need you to take at least 1 or 2 or 3 of these suggestions and making it kind of your personal mission to include these activities in your, let's say, advocacy work. So with that, I'll just give you my contact information. Thanks again for joining us this morning. If you want any materials sent to you, please contact me by email and I can send them out, or by sending an email to the website. So any questions or comments that we should take care of, Judy, before we close today?
I am not seeing any, but if we can leave it open for a few minutes and people can go ahead and type their questions into the Q&A section at the bottom. And then we can ask it if anyone has questions.
So if not, thanks again. And Judy, go ahead and wrap up.
Yeah, sure. Thanks again, everyone, for attending our quarterly meeting today. As always, there will be a follow-up email sometime next week with the link to the recording, as well as the materials shared today. So I can send out the document that Carolyn said that we would send out about social media and how to do things on social media if you have any questions about that, and PowerPoint presentation. So all of those items will be sent out. So just look for that in your email next week. And with that, thank you.